What we haven't seen, following the mildest December on record, is of course the perennial headlines about A&E departments in crisis, winter pressures, bed blocking, but a cold snap in January or February could see those headlines popping up as per usual. The headlines that we are definitely going to be seeing following the BMA's announcement of 3 strikes for junior doctors over January and February are going to be about this issue. Renegotiation of the junior doctors' contracts is a fundamental aspect of what the government is seeking to do in delivering upon the Conservatives' manifesto pledge of a 7-day NHS by 2020. So there's going to be an enormous amount of pressure from Number 10 onto the Department of Health and NHS employers to resolve this issue sooner rather than later. On social care, the biggest issue continues to be funding, of course. The Chancellor, George Osborne, announced a 2% precept for local authorities to put on top of council tax to pay for social care in the November spending review, but a lot of critics have said that that simply doesn't bridge the funding gap that remains in place. This issue is going to become exacerbated in April 2016 with the introduction of the national living wage. An awful lot of care providers who, of course, the very substantial part of their costs are staff wages. A lot of those providers are simply saying that they can't afford to pay the additional amount of money that comes through with the national living wage. This is an issue that the Chancellor may be able to address in the budget on the 16th of March 2016, but we're just going to have to wait and see.